My name is FERRONHA. I came from the beautiful city of Lisbon, the capital of Portugal, and I'm a urologist in the private system and also the public system. And I do implants, penile implants, and also urinary artificial sphincter. We started in January of this year, and we've done more or less 8 implants, and we are going to do more in the next weeks before the summer. So we had no rejection or infection until now, and we are very pleased. No mechanical failure, and all the patients are very pleased with the result. So the way it's right in our front, so we have to keep doing. I don't see any big difference with the other companies, with the implants of other companies. The principle is the same. We are talking about hydraulic implant, so the main system, the main technology is there. So you don't have to create or invent anything different. We only have to work in some details, and that details sometimes make the difference. That's the truth. And we adapt very well to your system, and we are very pleased with the technique because it's very easy. You can reproduce it. It's very easy to understand and to explain to other surgeons. So it's what we want. We want an easy surgery, no complication, and good results. When the implant is well done, and after the 4, 5, 6 weeks after surgery, the patient will be very pleased with the result. Also, the main infection risk is after the surgery, the first weeks. Also, the rejection, which is very rare. It's the main risk. It's also after the surgery, and when he could overcome that period, which it has some pain, some discomfort, and after that, maybe sometimes he has some ideas of regret immediately after surgery, because it has a very could have a hard post-operatory, I mean in terms of pains, but the result normally after 5, 6 weeks and after starting their sexual life, they are very pleased. And I think I don't know one man who are not pleased with the implant. Normally my approach is an incision, penile scrotal incision in the transition of the penile, in the basis of the penis, in the ventral aspect of the shaft of the penis. We normally only do one incision. Even to the reservoir, we use the only incision that we do for the rest of the implant. So we minimize also the scars and also the aggression to the patient. And you can do it only with a small incision in the base of the penis, in the ventral aspect of the penis. So that's our approach. In the surgery, we normally do 2 antibiotics, gentamicin, and also cephalosporin 2nd or 3rd generation. After the surgery, in the first 3-4 days, it depends how long the patient is going to stay in the hospital. Most of the times, just 3 days, counting with the day of the surgery, and we keep doing the cephalosporin, normally it's 2nd generation, and we have good results until now. Sometimes we keep doing in the ambulatory after the discharge of the patient, and normally it's also cephalosporin, but PERRONHA. That's the protocol that we normally use. Normally, we start teaching our patients in the 6th week. We know that some literature speak about starting in the 4th or 5th week, but the patient, for my experience, is not prepared. He is also keep complaining of some pains. He prefer that all his scrotum and penile start shrinking and the inflammation just go out, and after that he can concentrate really in the real purpose of the surgery. So we wait until the week 6 after the surgery and start doing the process of teaching. Of course, some patients we do it in the 7th or 8th week, so it's not a fixed date, but we try to do it in the 6th. And normally he starts using in the 7th or 8th, because he normally have to have 1 week of teaching and also of learning the steps. For penile implant, it's a patient with erectile dysfunction, of course, who the medical therapy it's not working anymore, or it doesn't work at all, or also has some contraindication of that type of treatment, and also a patient with good mental state, some ability in his hands, and the will of doing something to keep the sexual life with his partner. So that's the optimal candidate for that type of surgery. The main group for doing the implant are patients which have diabetes for some years, type 1, type 2, but with erectile dysfunction, who the medical treatment does not work, or men who were submitted to radical prostatectomy in the treatment of prostate cancer, and which the medical therapy does not work also. So these are the main groups to do the penile implant. For me to exclude someone with some neural disease that could put in danger also the sensibility, also the way of working with the penile implant, and also with some comorbidities which are contraindicated for that type of surgery, with coagulopathy and also other disease which could, or also some disease in his immune system in an active way that could compromise the quality of the implant and also the risk of infection of that implant. For the patients, don't be afraid. Touch an implant before you decide to do one. Ask your doctor for an implant outside, old implant, I mean not an old one, ask for a test implant. Try to see if it's a thing that you are prepared, mentally prepared, if you really want it, because there's no way back. So if you do it, you have to be completely focused on that purpose. And it's very easy when both patient and doctor are in the same path. So if you want to do it, talk with your doctor, ask him for a test and see if it's a thing that it fits to you. I think penile implants are a very good option for in the end of the line or in the treatment of erectile dysfunction. It's like I said, it's a very nice operation. It's very easy. It's not a long operation, and for the patients, the results most of the times are very good. So don't be afraid of something that they could tell you it's necessary to put something in your penis. So talk to your doctor, don't talk with your neighbor, talk to your doctor, talk to the people that are important to you.